Nearly 49 million Americans struggle with alcohol and drug addiction, also called substance use disorder. And studies show young people are at the highest risk. In fact, those between 18 and 25, they have the highest rates of binge drinking. And organizations like Alcoholics Anonymous, Narcotics Anonymous, and Shatterproof are there to help people who need the help. And this weekend, communities are coming together around the country for the Shatterproof Walk. It celebrates recovery and honors lives lost. Joining us now, our mental health expert, Marcy Hopkins, here at the table. You're going to be emceeing a walk coming up this Saturday in New York.
Yes.
That's great to bring awareness and break the stigma. First of all, 49 million Americans, that's a big number.
No, it's crazy. It's like 1 in 7 people that are affected. So that just means we're all touched by this disease, right? And really, I'm so excited that we're having these conversations, and there's so much work around this because it is these conversations that are going to change how we think about this disease. It is a disease of our brain, right? And we treat all other diseases so differently.
Right.
And so it's really important that we start bringing together community and realizing the help that's available and having these conversations so people know they can ask for help.
Marcy, I thought it was so interesting. In doing the research for this segment, I was looking at the American Addiction Center's website. They now believe that half of all addictions, even up to 60%, can be blamed on genetic factors. I feel like that's a new development over the past, decade or so. We used to think that, well, people don't have willpower. That guy, he's just, he can't turn it off. He's just fill in the blank for drunk of some kind. But the fact that it's genetic factors, it's what you're saying. I mean, it truly is a disease that needs to be seen through that light.
Yeah, it's so true. And just like me, I have broken the generational cycle. My mother was an alcoholic. My grandfather was. I mean, it's rampant in my family. I'm now 10 years sober. And it really does have to do with genetics. It has to do with environment. And a big factor is trauma. It's a big way to cope with trauma in life. And the more that we're using it to cope, it then becomes a way that our brain thinks that we've got to have this substance for us to just survive, right? And it also affects our reward system, right? That dopamine hit that we're getting, and we're slowly getting the dopamine hit, and then it changes. Our brain literally changes, and we have to have more of the substance or the alcohol to try to get that same high, and we're just chasing that all of the time.
That's what scares me the most about, a lot of us have teenagers, and they're going to experience life. They're going to go to college. They're going to get put in situations. But I feel a little bit like the prevalence and the normalization, especially of marijuana. I've seen just real life effects among my children's friends and people in our community of, I'm not saying you should stigmatize, drugs in terms of, but just making it seem so normal. You can't walk into a Yankee game. You can't walk into any place or walk down the street in New York and not just smell marijuana all the time.
Well, children and young adults think, I say children, like, people in middle school, in high school, and then in college. I mean, they're experimenting, and they think that because it is becoming so normalized to have marijuana, that it's natural and that we cannot become addicted to it. That's not true. That is not true. Just think that anything that we put into our bodies is going to change the way that our brain is wired and the way that it responds. And again, young people, they're starting to transition into adulthood. They're starting to experiment more. They have the freedom in college. They're trying to cope, they're trying to fit in, and so they're using it more and more. And that's why it's so important that, again, we have these conversations. There's early education, there's communication, and also the community, so that these young people can understand how the use of these drugs and alcohol the long-term effects of this, and help them so they aren't having this pain, this lifelong pain, dealing with addiction and this disease of the brain.
One of the things that's scary, I've done stories on, if you start with one drug and then you progress and you turn to maybe pills, and we don't know what's in pills if you get them online. Kids, adults can get access to these substances online, in some cases through social media platforms, and they don't know what they're getting, and they can be laced with fentanyl and can have deadly consequences.
No,
Very scary.
It's so scary.
If people are watching and they're thinking, I need help, but I don't know where to turn, or I think my kids need help, what do I do? What would your advice be, Marcy?
Well, there is so much help out there. I just want to say that first off. There's recovery centers, rehab, there's online communities, there's 12-step programs, there's sober coaches. You can also look on social media. There's also a big, huge community of us that are sharing.
So it can have a positive impact too.
Yeah,
social
so
media.
the help that is available. So I just want to say, please join us this weekend if you can, if you're in New York, for the Shatterproof Walk that's happening. And I'm super excited to be emceeing this event and the work that Shatterproof is doing to make a difference. So meet us at Pier 76 this weekend.
All right, we'll make sure we link that information so people
Okay.
can find it. Thank you so
Awesome.
much, Marcy.
Thank
We
you.
really
Always great
appreciate
being
it.
here.